a 34-year-old woman, core needle biopsy of a thyroid nodule. 2 hours later, anterior neck swelling with mild dysphagia. No history of easy bruising, epistaxis, or menorrhagia. Vitals are stable and labs are normal. What is the most likely cause of this complication? This is a classic hemostasis case, and it's in the form of a bullet point. I'm not gonna talk so much as nothing to explain. It's just something you need to know. That insufficient hemostasis is the most common cause of postoperative hematoma in patients with no personal or family history of easy bleeding and bruising. So looking at the case, choice A is incorrect. We know that von Willebrand disease is the most common inherited bleeding disorder, and we should put in mind that family history is an important clue. We see here that there is no family or personal history of any kind of bleeding, which by the way may be normal or most likely to be normal in von Willebrand disease, so this may not totally exclude it as an answer. Also in von Willebrand disease we expect high PTT. And looking at the case we see it normal, which again might be normal in von Willebrand disease, so this may not totally exclude it, at least if there is no better answer. B, factor VIII deficiency, which is hemophilia A, is also wrong, because PTT should be high, and also there is no history. And a quick reminder, we used to say it hemophilia 8, not hemophilia A, to always remember that the reduced factor is factor 8. So we say hemophilia 8, not hemophilia A. Choice C, platelet adhesion defect, incorrect. Bernard Soler, a very, very rare disease, never asked about, just forget it. Choice D is our answer. And as I just said, it's something you need to know. Insufficient hemostasis is the most common cause of postoperative hematoma with no personal or family history of easy bleeding and bruising. And you should also know that it's not a disorder, it's a technical or procedural problem, like due to inadequate compression or cauterization. And if we compare it to choice A, von Willebrand disease, it fits better. Choice A, DIC, incorrect. So much to say, but I think that labs are enough to exclude it. And here are our side notes which I recommend you to read.